what you see here is the actual pump that sustained Vincent's life for 267 days. And so with this device, we're able to support one or both sides of the heart, the left or right ventricle. In Vincent's case, we supported the left ventricle. We implanted the device, attaching one part of the device to the left ventricle, this cannula here. The blood would flow into the sac contained within this plastic chamber. There is a drive line, an a hose, which activates the pump on a regular basis according to the rhythm of his heart. And the blood is ejected to the aorta, which then circulates to the rest of the body, providing oxygenated blood to his vital organs. And so with this, Vincent was able to make a very good recovery of his multi-organ problems that were associated with his original heart failure. So we reversed all those problems. It wasn't easy, as Eric mentioned. Vincent required numerous operations. Soon after the implant, he required 2 pump exchanges because of the accumulation of blood clots within the pump, putting him at risk for an embolus and strokes. So we exchanged the pumps on 2 occasions. And therefore we supported him for 267 days. Now, as Vincent made a progressive recovery with the aid of the mechanical assist device, his condition improved, making him a better and better candidate for a subsequent heart transplant. And so when a donor is identified for Vincent, there are several aspects that we have to match with regards to the recipient. So we match the donor for the size of the donor relative to the recipient, for the blood group, and a few other items which we ensure will match very well with the recipient. And in this case, we had an excellent opportunity to conduct a safe heart transplant in Vincent. And so on the day of his transplant, we had 2 teams that were organized, one here at the Montreal Children's Hospital to arrange to prepare Vincent for his transplant, and another team that was deployed to the donor site, the site where the donor heart was available, to procure that donor organ. And so you can imagine the organization that requires to deploy 2 teams in different geographies, in different places, and to time the interventions correctly so that we minimize the amount of time that a donor heart is kept outside of the recipient. And so in this situation, we were able to coordinate precisely so that as soon as the donor heart arrived to the Children's Hospital, we were able to carry out the heart transplant. And this entailed, of course, reopening the chest, removing the mechanical assist device, the Berlin heart, and implanting the new donor heart.